What is the leading cause of global disability, of disability-adjusted life years? In every country in the world, spine disorders are the leading cause of global disability. And yet, there is not one country that has spinal disorders on their list of priority agenda items to treat spinal disorders. So what happens when a person has a spinal disorder? Well, they may access healthcare through a general practitioner or through a specialist. And what will that lead to? That will lead to either drugs or surgery. And does that lead to better function or does that lead to disability? Well, for the most part, because we see that spinal disability is the leading cause of disability in the world and the greatest burden of disability in the world, clearly we are not dealing with this form of disability very well. So what is the outcome of this form of disability? The outcome is moving less. And what does that lead to? Well, moving less will clearly lead to obesity, one of the major problems that we have around the world in terms of health outcomes. And what does obesity lead to? Obesity leads to increased blood sugar and diabetes, type 2 diabetes. Is this a problem? Yes, this is a major problem in our healthcare system and a very costly one at that. It also leads to increased cholesterol levels because if you burn 3,500 calories a week in exercise, you will lower your triglycerides, you will lower your LDL, you will lower your VLDL, and you will raise your HDL levels. You will essentially, for most people, normalize your cholesterol numbers. However, this is not well known in medical literature, but it's the truth that if we move more, we can actually stabilize our cholesterol. And what does that lead to? If you reduce diabetes and you reduce cholesterol numbers, you also reduce cardiovascular risk factors. So we've now knocked off 3 of the biggest health challenges that we deal with in public health: diabetes, cholesterol, and cardiovascular risk factors. But there's more. We also, if we move at least half an hour a day, and preferably more, we also lower our risk of various cancers: colon cancer, breast cancer, and various other cancers that will be reduced in their frequency if we continue to move. The ancient Chinese medicine has a theory about what cancer begins with. And this is a system that is 2,500 years old. And what they say is when qi is not moving, when the energy of the body is not moving, you get stagnation. And stagnation leads to nodules, and nodules lead to cancer. So if we are not moving, we are clearly leading to more and more disease. And it doesn't end there, because we also know that when you move on a regular basis, you also reduce your risk of mental health disorders. Walking a half an hour to an hour every day is known, and especially at a vigorous pace, is known to reduce anxiety and depression, 2 of the biggest factors in mental health disorders. So we can see that some of the biggest challenges in healthcare are actually being treated after they appear, rather than going upstream to understand where do they come from. We can do a much better job of preventive medicine by keeping people moving. And here's the question: is there evidence-based care for spinal disorders? In fact, yes, there is. The problem is that there is almost no jurisdiction that is using evidence-based care for spinal disorders. What is evidence-based care for spinal disorder? Well, the first thing is good diagnosis, because not everything is mechanical back pain, but about 80% of back pain is mechanical back pain. So those cases that are not, they could be tumors, they could be infections, they could be fractures, and we have to diagnose those well and get them to the proper medical care. But for all of that mechanical back pain, there are two things that are known to be effective in reducing the burden of that disease, and they are exercise and manual therapy. So we know that the best care for these conditions come from physiotherapy and chiropractic. And yet, these are services that are not covered in most universal healthcare systems. To acknowledge this fact, and we need to work towards behavior modification to get the biggest bump in our healthcare spending. The country of Cyprus has one of the lowest costs of healthcare in the European Union. And yet they have one of the highest life expectancies in Europe. So does that say something? Does that say that perhaps they have better behaviors and they are living longer as a result? We need to look at these facts more clearly and adapt to them more directly, because what we have is a crisis management system, and adopting universal health care is only going to be an expensive expedition and a failed one. We know that the United States has the highest cost of health care in the world, and yet their outcomes are the 38th best in the developed world. That is not good return on investment. We need to understand there is more that can be done, and the more is behavior modification. We need to get people moving and keep them moving and eating good food. And we need incentives for people to buy good food. And if it means taxing sugared beverages and junk food to subsidize healthy produce in marginalized communities, we have to do this.